And the issue would be though is, and they'll talk to you about that, but you're not dilating. Let me see. I was trying to see on here. Did it tell us what?
Hi everyone, and welcome back to my channel. So for today's video, I have my 15-week pregnancy update and appointment. So if you guys are interested, then keep on watching.
Any questions or concerns?
Yes. I've been having lately a lot of dizziness to the point where I think I almost like fainted. A lot of abdominal cramp and breast pain. And my breast, specifically in the areola section, or area I should say, it's been red dry, and then yesterday I noticed it was like very dry and patchy.
Okay. What kind of soaps do you use?
Right now I think it's the Irish Spring.
Okay, because I'm wondering if that's probably drying you out a little bit.
Okay, so maybe just switch out to a more...
Maybe milder.
Super.
So,
okay.
Like some Ivory or some Dove unscented.
Okay.
Yeah, something very, very mild. That won't irritate your skin.
And with the whole VBAC, I just, like you said, wait until the 3rd trimester to see if they deem me to be a good candidate for it.
Well, I looked at your operation report, and the only reason you had the C-section is because, what did it say? It says failure to dilate, and I guess your kidney ruptured.
Yes, because what is it? My water broke on its own.
Yeah. And the issue would be though is, and they'll talk to you about that, but you're not dilating. Let me see. I was trying to see on here. Did it tell us what? It didn't say exactly how far you got.
If I remember correctly, I think it was 2, maybe 3 centimeters, if I'm not mistaken.
Really?
Yeah.
So they didn't want to give you time, or how long you had been at that dilation?
My water had broke around 6 in the morning. I got to the hospital at 7. I was not dilated at all at that point, and then when they suggested a C-section the following day, I had gotten about like 2 to 3, like I said, and I was scheduled for the OR around 4:30 Sunday.
Okay.
Because they were also concerned at the fact that the Cytosec was giving me a lot of like side effects, and they had to put me on oxygen 3 times throughout the night. And then they were saying that Riley wasn't positioned correctly or something like that.
Okay.
So they were at that point, they were like, we can try another 12 hours and see if you progress, or just do the C-section right now.
Oh, okay. And so what we use is we use like a little calculator.
Okay.
And we put in like the reason you had your C-section, your weight, your race, and all of that good stuff. And that calculation will actually give us percentage on how successful you may be this time around.
Okay.
So that's what the docs will actually do with you to see if you're a good candidate. I mean, it's certainly you certainly can try, but they're going to give you the stats.
And then they would also tell me like the risks that would come with having one.
Absolutely. Yeah, that's what that counseling will be for.
Okay.
And we'll do that in the 3rd trimester, so you got some time for that.
Okay, sounds good.
Yeah.
As you guys heard, I've been having a plethora of symptoms. Some new, some old, and then just some that are just going nuts. So let's dive right in. Symptoms, I've been feeling a lot of itchiness and experiencing a lot of redness around my areola, specifically my left one. I don't know why. The left one is more flared up than the right, but it is what it is. It is so bad, I literally want to rip my skin off. Kid you not. So I will follow suit with what the nurse said. Maybe it is the soap that I have been using. So I did purchase Olay bar soaps. So hopefully that will take away the itchiness and the redness away. I pray, because it is not fun, you guys. Also, I have been experiencing a lot of breast pain, and I do chalk it up to just my boobs are growing. They literally have doubled in size, and I didn't think that could be possible, but hey, it's pregnancy, right? Anything is possible. They have gotten so big. My boobs, I could actually, fit them in my hand. At one point, now my hands are not enough to cover them. They do feel a lot bigger. Sometimes they will feel a little bit hard, if that makes any sense. But yeah, I will also see a lot of veins. Like, the veins will be very visible in front of your boobs. I asked my mom, like, what was that all about with Riley? And she just mentioned that that's just like blood flowing, just getting everything prepared to like breastfeed down the line. So if you see that, don't be freaked out. I am still feeling very nauseous, and I'm not throwing up as much as I am dry heaving, which I don't know what's worse, throwing up or dry heaving. I would have to say dry heaving, because at least when you're throwing up, you kind of feel better afterwards, and it's actually something that's happening, as opposed to when you're dry heaving, nothing really comes out, and it's just like I went through all that crap for nothing. But nauseous, I am feeling that 100% all the time still. I have been taking the Unisom at night, and that has been a tremendous help, because now I'm no longer waking up in the mornings feeling super nauseous. So that is very good. I have been experiencing a lot of abdominal cramps. It's like somebody's taken a knife and is just poking you from the inside out. It's the worst feeling ever. Sometimes I'll feel that pain in my breasts, but just like how I said and the nurse mentioned, it's from the fact that my breasts are getting larger. So that's that. A new symptom that has arisen from all of this has been back pain. I've actually been experiencing a lot of lower neck and upper back pain, to the point that I actually have to start stretching out my back more often, especially in the mornings, because I will wake up a little bit more hunched over, very stiff sometimes. So I will do a lot of yoga poses in the morning, or just a lot of back stretches, because it is painful. It's awful. At times I will use my TENS unit that I have here for like 20 minutes in order to relieve any tension in my muscles, so that also helps. So I mean, this comes with pregnancy, a lot of back pain, and it's only going to get worse as I get bigger. Sorry, there's people coming down the stairs right now. It's only gonna get worse as I get bigger, because of the belly and everything else that goes with it. So I just gotta figure things out. I think I might end up getting the pregnancy wedge that a lot of people have been talking about, and not the pregnancy pillow this time, just because we don't have a lot of real estate on our bed. But I also do agree with what other people have said, that it is very it's a hassle sometimes to have a pregnancy pillow, because you have to like adjust it all the time, and if it falls off the bed you gotta like pick it up. It's very annoying. And with the pregnancy wedge, you just kind of stick it on your side, from what it seems like, and then you just roll over and you have your belly and you're good to go. So I think I might go that route this time. As you guys heard, we also discussed whether or not I wanted to have an elective cesarean or a VBAC. I want to go the VBAC route, just because having a C-section is a shitstorm, and the recovery time is horrible. I do not care what people say. People out here say that having a C-section is a cop-out. No, it is not. You are having a major surgery while delivering your child. That is not a cop-out. I am sorry. You have to recover fully. I think 3 months, because okay, yes, it might be on the outside at six weeks, whatever. It may look good on the outside, but on the inside, that thing is still healing. So you can't lift anything up no more than like 5 pounds, literally like just your phone. You can't bend over. You're walking the first couple of weeks hunched over because you feel like you're cut in half. You were literally cut in half. And then just sitting down, getting up, and just doing the most banal things in the world have become 10 times more difficult. So I want to have a VBAC just because like I said, I know the recovery is worse. And with a toddler, yeah, I don't want to be, worrying that she's going to get something or put herself in danger just because I can't get to her in time. Or, if the baby needs something and I can't get to him or her, it's just a lot of hassle. So I do want to try for a VBAC. Not saying that vaginal birth is any easier, but the recovery for both is just way different. One takes longer, the other one you're basically walking hours later. Just facts. But I do want to have that. They did get my medical records from the hospital where I delivered Riley, and like she said, it'll be more of a discussion once I hit the 3rd trimester and I'm speaking with the physician. Hopefully, whatever calculations that they do, I do have a higher success rate. Because I did discuss it with my husband before filming, and he said, if it's a high risk for you, I would rather you have a C-section than, losing you or losing the baby. And I agree with that 100%. So hopefully my success rate with whatever they use to calculate that with is very high, and I can definitely have that. They're also, going to discuss the pros and cons of having a VBAC. One of the biggest cons of having one is that when you have a C-section, doctors are more concerned with the fact that you may have a uterine rupture, which literally means that your uterus will rupture and you will hemorrhage. And that's more likely to happen if you have your pregnancies very close. I think the minimum wait time between your first and your second pregnancy to even attempt a VBAC has to be 18 months. By the time I give birth, Riley will be 26 months. So she'll be a little bit over 2 years of age. So hopefully that will play in my favor and I can definitely have a VBAC. Do I have a birth plan? Not as of yet, and I don't know if I'm going to, just because the last time I did have a birth plan. And guys, I'm gonna be really honest with you. Labor and delivery, as much as you plan to the T of how you want it to go, it's not gonna go the way you plan it. Just being really honest with you. I planned for a vaginal birth and I ended up having a C-section. Things just happen. I didn't dilate enough. My water broke and it had been broken for over 24 hours at this point. Riley was, her heart rate was just erratic and crazy. I was on oxygen for 3 points at the time throughout the night. And, side effect was causing me to just throw up all over. Pitocin wasn't helping. So it's you can plan a lot, but with labor and delivery, I feel like you have to really be, what's the word? Just go with the flow. You really have to go with the flow because anything can happen. You try to plan for things that you can have control over, like if you don't want any narcotics, if you don't want any epidural, if you don't want certain things to happen, if you don't want medical students in the room with you, those things you can kind of have more control over, as opposed to no, I don't want a C-section, or I just want a vaginal birth. You get what I'm saying? So I feel like I will most likely have a very loose birth plan as to what I want, but it won't be something that I'm going to stick strictly to it, just because I know things will change and you really just have to go with the flow of it for your safety and your baby's safety. Lastly, I do want to discuss my weight. I am currently weighing about 157.8 pounds, which is a good thing and a bad thing. A good thing because I've only lost a pound between my last appointment, which was on the 12th of March, and today being the 20th of April, so only 1 pound, nothing too crazy. But then again, on the flip side, you know, I did lose a pound, which I shouldn't be too upset about because, like I said in the beginning, I did lose about 5 pounds within a span of like a week and a half to 2 weeks. So I'm not too upset that I did lose a pound because I can always gain that back. It could also be water weight, and it is pretty common in the first trimester to lose weight, especially if you are throwing up and nauseous. So hopefully as the weeks progress and I get more into my second trimester, I will gain all the weight that I've lost since confirming my pregnancy, and then a little bit more. Not too much, just because I don't want that to hinder, you know, or be an obstacle for my VBAC. But I don't think that's going to be an issue because I am eating pretty healthy. I'm eating a lot more fruits and vegetables this time around. Not a lot of meat. I get my protein, you know, sometimes from eating beans, or I'll eat fish, but red meat and chicken, I really just can't have that right now. So hopefully in the second or the latter part of the second trimester and in the third trimester, I get over this and can have more protein. And now I'm going to show you guys my 15-week bump. This is how my bump is looking at 15 weeks. But that is it for today's video. If you guys enjoyed it, please give it a thumbs up. It does help me with the YouTube algorithm when you guys hit the like button and leave a comment down below in the comment section. Please do not forget to subscribe and hit the notification bell so that you're notified anytime I post a new video. And as always, thank you guys so much for watching, and I will see you guys in my next one. Bye!